So how are you, all of you? How was the day today? How was the day? So how are you, all of you? How was the day today? Tomorrow would be our exam. I know, I swear. Stupid people who are there in the, all these higher up posts, they really don't understand कि bhai, it is actually a matter of great distress to students. Rumor nahi hai, Dr. Amisha, there is this one doctor who is a student also. She has made a video on this. कोई rumor नहीं है. अभी तो अपन इससे हो चुके हैं कि भाई एग्जाम कभी हो जाए, वी आर रेडी, है ना. सो लेट अस नॉट, एंड वैसे एज फार एज आवर थिंग गोज, कैलकुलेशन कह लो, इंटेल कह लो, कुछ कह लो, इट इज गोइंग टू बी इन मार्च at the most. If they really want to push it forward, it is going to be in April. I don't know, but still I don't know. Dr. Kiran Bala, that is, what is killing me also, because we are telling you to keep on studying with no definite marker, and many of you, will lose out on this. Many of the good students will lose out because burnout ho jayega, right? And the burnout should not happen. So it's okay. That is why, I also never take class maybe in the evening, or I give you an off the whole day, because mujhe burnout nahi chahiye. Right? As soon as your date is announced, we are going to be on a 3-hour schedule, like we planned, 2.5 to 3 hour schedule. We are going to be there. Abhi I am a little relaxed, right, in your schedule also, because I don't want the good students to burn out. कि थक गए मैम, अब फिर वो बुरा हो जाएगा, राइट? डॉक्टर कुनिका सर को पता नहीं है, मतलब सर also knows what I am telling you, right? Sir also knows this much what we have been telling you, and इससे further information I don't think there is anybody in India right now who knows, and we know it because we have a very close contact over there, but that close contact is not allowed to speak now, right? वो allowed ही नहीं है, so I think it's not out. ठीक है, चलो पढ़े स्टार्ट करें. बट फर्स्ट आई वांट ऑल ऑफ यू टू रिपीट आफ्टर मी. ये रिपीट करना है. वी हैव टू वर्क हार्ड, मेहनत करनी है. वी हैव टू बिकम द बेस्ट, एंड वी हैव टू स्नैच द सक्सेस. छीननी पड़ती है बेटा सक्सेस. एफर्टलेस इज अ मिथ. एफर्टलेस कुछ भी नहीं होता है. So you have to work hard. You have to become the best. Best बनना है बेटे, right? And you have to snatch your success. You just don't have to give it to somebody else. Just because you feel you cannot study, you will not give it to somebody else. और अगर give it करना है ना, तो फिर give up करना पड़ेगा, right? चलो start करें. Pharmacodynamics is effect of what on what? Who will tell me? Last PTR mein we have done it. Yes, action of drug on the body. Now the first question which comes is the potency and efficacy, and for this you have to cry help. You have to say help, right? What is help, bete? Help is higher is the high efficacy, more efficacy. If left is the graph, more is the potency. Help. Correct हो गया. So now if I see from A and B, B is high efficacy, right? And A is having more potency. Simple. So अगर मैं बोलूं इस डायग्राम में high efficacy किसकी है? B की, because it is higher, and high potency अगर बोलूं तो it is of A. I hope it is clear. Now, there is this question for all of you. Let us see, all of these are the jumbled up graphs, right? Now, A is more dash than B. A is more dash than B. A is more efficacious. Simple, a cry for help. And A and B are more dash than C. C, as you can see, they are on left, so they are more potent than C. I hope this absolutely has no problem, right? Absolutely, there is no problem. Next, everyone, please let us first do what is affinity. Affinity of a drug is ability to bind, and intrinsic activity is ability to produce action. Now, bete, after I do my journal pharmacology PTR, journal pharmacology should be revised within 10 minutes when the exam is announced. 10 मिनट से ज्यादा नहीं लेना, वो है PTR. Right? If you take more than 10 minutes, gone. Okay, next. Again, a very important diagram, again, a very important graph. Full agonist is somebody who has intrinsic activity as +1. Partial agonist की intrinsic activity is between 0 to +1. Partial agonist, see, 0 to +1. Full agonist is obviously higher. Antagonist has intrinsic activity as 0. You can see it is on the baseline. Whereas inverse agonist has the intrinsic activity as negative. Is this point very clear? So they can give you these graphs. They can tell you A, B, C, D, and they can tell you, okay, bhai, please tell which is a full agonist, which is a partial agonist, which is an antagonist, which is inverse agonist. Right? Inverse agonist, negative, -1. Correct? Very good. Next is again a very important graph, log dose response curve. Now, log dose response curve is S-shaped. But please remember, dose response curve is hyperbola. But it is not used. We use the log dose. Very important, log dose curve. And why is it important? Because it tells us about 3 things: potency, efficacy, and the slope tells us about slope, safety. Slope, safety. What do I mean by that? Right, everyone? ये सब आता है ना? Easy है ना? But in PTR we are revising it. Right? So now, slope safety, if it is a flat slope, we say the drug is safer. If it is a steep, we say it is less safe. Right? Clear? Very good. Next is beta ED50, LD50, again very important. What is ED50? When 50% respond to a particular dose. 50% of the population, effective dose. Lethal dose, when 50% of the animals or tested animals or the patients die after receiving this dose. Correct? LD50, ED50, correct? Next, obviously lethal dose है एक effective dose है, so it is very easy to know. Lethal dose will obviously kill, right? Therapeutic index is LD50 by ED50. Very important. याद रखो, therapeutic index. Now in the exam you may get confused, मैम ED50 है या LD50 है? Please remember LED होता है, LED bulb. Right? So LED bulb, so lethal first, effective later. Okay. If more is the therapeutic index, right, then what it is? Less is the therapeutic index. That means what it will be, everyone? ये हमने पढ़ा हुआ है ना? If the therapeutic index is more, That means the amount of drug which is needed to kill is more. So that means you can give that drug to a better or a more extent. सपोज हम मानते हैं एक ड्रग का है 100, सपोज आर्बिटरी एक ड्रग का है 50. Now 100 drug वाले को we can give it to a little bit more stretch period and we can give a more dose. So more the therapeutic index, that means the drug is safe, right? Less it is unsafe. Please understand like this, if the therapeutic index is more, simple, LD50 is more. LD50 is more, numerator is more. That means you can give a drug in a more amount. Correct? Next. Clear hai sabko? Give me a thumbs up. Give me a thumbs up, everyone. And narrow therapeutic index, please remember one drug which always comes into your questions, aminoglycosides. See beta, these are the questions which are the sure shot. Earthquake questions, क्या बोलते हैं इन क्वेश्चन को? वही घिसे पिटे questions, but they determine your rank. ठीक है? I don't mind if you मतलब don't answer the difficult surgery questions, but if you miss the easy Pharmac questions, we are gone. Okay, next bete, addition, synergism, potentiation, tachyphylaxis, permissive action. Drug interactions are important. Addition is aspirin plus PCM. Examples आते हैं पेपर में. Aspirin plus PCM, 2 plus 2 is equal to 4. Correct? Synergism is clopidogrel plus aspirin. It's a double antiplatelet therapy and it is beneficial or more than a single therapy. So 2 plus 2 is more than 4. Potentiation is when 1 is 0. So 2 plus 0 is more than 2. Carbidopa and levodopa. Correct? These examples come in the exam. Tachyphylaxis. What is tachyphylaxis? When you give a repeated dose. We will come to this box again once in the end. We will elaborate more into this box. We will add another examples and some other questions, but later. First, let us finish what is there in the PTR. What is tachyphylaxis? It is the repeated dose of a drug which decreases response. This is especially example theophylline. Very important. And what is permissive action? Permissive action is everyone, जब one drug permits the action of another. So classical example which comes is cortisol plus catecholamine. Cortisol plus catecholamines. Right? For the catecholamines to work, we require cortisol. So we say cortisol has a permissive action on catecholamines. Repeat question. Okay, very good. Now beta, this competitive antagonist, non-competitive antagonist is very important. You must know it. Competitive antagonist में क्या होता है, non-competitive में क्या होता है, and this chart is very important, right? And you have done it in biochemistry, so I'm just going to write it. Now, competitive antagonism में E only, right? And competitive, remember as competitive, Km. So beta, here the Km increases, Vmax has no change. Has no change. Non-competitive में E and Es both act. The Km remains same. Vmax decreases. In partial agonist बाद में करते हैं. There is one more uncompetitive. in this enzyme substrate complex that is acting, and in this both Km decreases, Vmax decreases. In partial agonist, please remember this decreases efficacy. This has been a question. Example is buprenorphine. Right? So this chart, and especially beta this question, what happens to the Km and what happens to the Vmax is very important. Competitive antagonism, non-competitive, uncompetitive. Uncompetitive may both decrease. Repeat question, either it can come in your biochemistry or it can come from your Pharmac. Simple. Right? Next, everyone, physical antagonism, just examples I am doing. You all know when you give something physically and it stops the absorption or anything. Like, for example, you are giving charcoal. Chemical antagonism, example, all the chelating agents. Having said that, please note lead वगैरह के सब के chelating agents, iron का chelating agent, copper का chelating agent, copper poisoning, iron poisoning, lead poisoning, all should be on your tips. Right? Physiological antagonism is when the drugs bind to different receptors. Example, histamine and adrenaline. But they are opposite in action, but they bind also to different receptor. Pharmacological antagonism is when the two drugs bind to same receptor and have opposite action. Okay, antagonism hai to opposite action is understood. Their example is adrenaline and beta blocker. Is the lecture clear till now? Is your PTR clear till now? Yes, give me a thumbs up, everyone. If it is clear, give me a thumbs up. Okay, permissive action is when one drug, okay, which is the main drug here, cortisol. Cortisol permits another drug to act. Having said that, like, let us take an example. कि भाई, for you all to study very well, है ना, at home, if you are at home, what is the most important thing? Your mom. Right? When you were a kid, she used to wake up, she used to give you milk, she used to make you study. Right? So mom is the cortisol. Action is you. Catecholamine does the action. But you need your mom. Always. Right? So cortisol is the mom. You need cortisol so that catecholamines can act. Okay. Now coming back to this chart again, there are certain things which I want all of you to know. Synergism का एक question आता है which no one asked me. I'm surprised. Why didn't you ask me कि मैम most important question बताओ? ये तो सारे question are there, but the one of the most important question which always comes, INI हो चाहे जो हो, cotrimoxazole. Cotrimoxazole, bete, which has sulfamethoxazole and trimethoprim, is an example of synergism. Always this question is repeated. Antacids, they are chemical. Antacids, when you give, they are also chemical. Charcoal is physical. Drug stops physically the absorption of another drug. Correct? So this is very important. Cotrimoxazole, repeat PYQ. Right, everyone? So done till here? Okay, let us do now very easy stuff, but it always comes in exam. Drugs which are metabolized by acetylation. I think everyone knows this. Ship drugs. Sulfonamides, hydralazine, INH, and procainamide. Sulfamethoxazole, bete, Dr. Muskan, sulfamethoxazole, repeat PYQ. And one more thing, beta, by now you must be knowing. If, see, simple rule. If you have not done PYQ, you are out. If you have not done MCQs, you are out. If you have not done the important theory of the important MCQs, you are out. It is in your hands, everyone, what you make of your life. Okay? A little part of it is played by the destiny, but major lies in your hands. Fine? Okay. Next, drugs causing G6PD deficiency, and it leads to hemolysis. If you give this drug to a person, तो सबसे पहले इसमें लिखोगे black negro, fava beans. Very important. A black negro took fava beans, started having hematuria, G6PD deficiency. Right? Another drugs आता है इसमें, the very famous Danish drugs. So what are they? Dapsone. Yes, aspirin. That's like my very brilliant kids. Anti-malarial. Do not forget Primaquine. Primaquine, beta, very important. Primaquine. Nitrofurantoin. And nitrofurantoin is the drug which causes lung fibrosis if it has been used for a longer period of time. My question in the Insta video. Next, sulfonamides and hydralazine. Correct? Next, drugs which are safe in pregnancy. Drugs which are safe in pregnancy. See, beta, let us revise them. I have a full lecture of safe drugs in pregnancy. I have given it to all of you. Please watch it. Okay, beta, whatever is in my power, I am doing it for you. Right? Now, beta, everything is in your hands. Correct? And of course, God. Next, let us see. Antihypertensive of choice in pregnancy, you all know, labetalol. Even in it is also used in hypertensive emergencies. Next, anti-diabetic. Okay, beta, I will show you the Danish drugs. Normal नहीं है labetalol, oral है. Normal hypertension, oral. If it is a hypertensive emergency, it is IV. Written, everyone? Dapsone drugs. Anti-diabetic drug of choice is insulin. Anticoagulant of choice is heparin. Anti-thyroid, all I have taught you, bete, is PTU. Antimicrobial is PCM. क्या होता है PCM? Who will tell me? Penicillin? Penicillin? This is for you to decipher what is PCM. Antimicrobial, PCM is not, obviously it is the NSAID of choice also. So NSAID of choice is PCM. Okay, so it is paracetamol, right? But antimicrobial is also PCM, penicillin, cephalosporins, and macrolides. Very important. Next, antiemetic of choice, doxylamine. And if a pregnant lady develops bipolar disorder, then we give antipsychotics. Right? Okay. Next, everyone. And please, isme I have a full lecture. Right? Full lecture, I think, of 20 minutes or 25. प्लीज वॉच इट, कुछ भी आ सकता है उसमें से. नेक्स्ट, counterfeit drugs. These are just one liners which come. Counterfeit drugs are the fake drugs. Spurious drugs are the drugs which are manufactured under the name of other drug. So imitation होता है. Me Too drugs are same drugs as known. Like we all know paracetamol is a drug. So you make a same drug, right? Orphan drugs is the question which always comes. So what are orphan drugs? Orphan drugs are the drugs which are used for rare medical conditions. One of the very good example is N-acetylcysteine. Dr. Heather, anti-epileptic, everything is there in that lecture. Please see कौन सी है, which anti-epileptic is having the least one. I am giving you a hint. It starts with L. Right? Schedule H. Retail only on prescription. I know. I don't know. Let me see. Schedule G is also under medical. And दो होती हैं, both start with L. You are right. दोनों L से start होती हैं. Under medical supervision. Over the counter drugs, you all know which we get. Aspirin हो गया, NSAIDs हो गया, they all are that drugs. Schedule X drugs are not without, never to be given without valid medical prescription. And Schedule P means on life period. You know, on the package, you have to write the life period of drugs. So this is for the retail pharmacy. They always need to know when is the drug expiring. Very good. Next, beta, again, this chart always comes. There is not even a single paper or a year. This particular chart is repeated either in NEET or in INI. So drugs based upon their temperature of storage. So what are the store frozen drugs? The temperature is minus 20 degrees C. Do not freeze, keep cool is 2 to 8 degrees C. Keep cool. Keep cool is 8 to 25 degrees C. And store at room temperature is around 15 to 25, or they can also say 30 degrees C. Okay. So these two charts are very important. ठीक है बेटा? So what is PTR? अब तक आपको समझ आ ही गया होगा. Now from Monday, whether the date comes or not, I am going to start and launch the PTR series because I waited enough now, and आप लोगों को भी you will get a direction, right? So what I have planned is dental का quiz चलाएंगे after CVS and medical का PTR करेंगे, right? And then when you get selected, good. And after that, if you really want to apply even for the INI, तब हम dental PTR भी करेंगे, right? I hope this will help you out. We will have a dental quiz and a medical PTR of everything, of patho also, micro also, surgery also, anatomy also, everything. Okay. Yes, we have to start. We cannot keep on waiting. No, Abhi, I was not starting it because we never knew what could be the date. Now, at least I have like 45 days in hands and you all have prepared now. Right? So now you all need a direction, but provided. शर्त है उसकी. शर्त ये है PTR start होने की. I will give a poll on Sunday. ठीक है ना? और उस poll में I want truth and nothing but the truth. शर्त ये है all of you should have done your syllabus at least twice, once or twice. Second शर्त ये है कि PYQ मेडिकल के तो I have made you learn, dental के you should have finished by Sunday. Because if these two basics are not done, then PTR will not work. Got my point? I will give you the point, I will give you the points, everything, but the PTR will make you a topper once you are thorough with these two conditions. Dr. Vaishnavi, dental PTR अभी नहीं हो पाएगा. Though everything I prepared, but dental PTR का risk अभी नहीं ले सकते. Right? Because I start with it and then suppose it comes, your date comes, then we will be left again stranded with the medical. Right? So first, let me just concentrate on the medical PTR. Dental ka simultaneous quiz will happen for the next 45 days. And from beginning from Monday, not from tomorrow. Right? So I'm giving you like 2 to 3 days to complete your backlogs. And I hope there are none now. Okay. Now again, second paragraph or second chart, which is a repeat and which is the favorite. Phase 1, phase 2, phase 3, phase 4 and micro dosing. Right? So micro dosing is phase 0. Okay, Dr. Arjun, I will give you, but that won't help you now. That won't help. Okay, I can give you more questions, but if you have done your notes and if you will attend the PTRs, all the PYQs and everything will be done. Okay. Next, phase 1, human pharmacology and safety. Name uska hai. It is conducted on healthy individuals. And why it is done? Very important. It is done for MTD. What is MTD? And safety and tolerability. Tolerability. Correct? So important. Next here, this is therapeutic. Second phase is known as therapeutic. Exploratory. It is done on patients. And here therapeutic efficacy. Correct? Phase 3 is therapeutic confirmatory. It is done on heterogeneous population. And why it is done is very important repeat question to confirm therapeutic efficacy. So beta, this is a repeat question. Which phase, in which phase do you confirm therapeutic efficacy? And which phase, even this is very important question, is post marketing surveillance. In this also we take into consideration the patients which are treated by the centers. And this is done to know the long-term adverse effects. Next important question is microdosing. Microdosing is known as phase 0 and it is done in healthy volunteers. And why it is done? To know about pharmacokinetics. I hope this all of you know. This has to be on your tips, bete. Anyhow, this has to be on your tips. Okay. Next, if you have noted all of this, I want to highlight here teratogenic effects of drugs. You have to know. Antidotes you have to know. Drugs in pregnancy, you have to know. All I have covered in my elaborate lectures, which you need to know. Correct. Phase 4 is done on the patients. Not very important, beta. If I have not written it, that means it is not important. Phase 4 is done in the patients which are being treated by the centers. And one more thing about the ship drugs. एक तो acetylation है, and second, they can also cause SLE. So please remember, this question can also come. Which drugs cause SLE? The ship drugs. Okay. Another extra point is why the enteric coating of drugs is done. See, any drug like PPIs are coated. Why? So that the acid does not attack them. Okay? Dr. Bhavya, I'll check it out. Right? And plus, it can protect, the enteric coating can protect the gastric mucosa also. So, two ways it works. It protects the drug and it protects the gastric mucosa. Correct? So, clear till here, everyone? Clear till here? Yes? Okay. Now I have made certain assorted tables for you, and I'm going to highlight the important PYQs. You don't have to learn all. So, what are the nephrotoxic drugs, everyone? Please remember aminoglycosides, very important. Please remember amphotericin B, which is the drug of choice for mucormycosis. That is why we use LAMB, right? We don't use the normal amphotericin B because it is very highly nephrotoxic. Another kind of question that can come is, a patient was given amphotericin B. What test should you do for him? LFT, KFT. So you should always check for the kidney function test, KFT. Right? These two are very important. Rest, whatever you can remember. Okay. Next, this question also comes. Antibiotics which are safe in renal dysfunction. Matlab, somebody is having a CRF, somebody is having chronic renal failure or any kind of renal disease. What can I give him? So I can give him a dancer. Doxycycline, ampicillin, neficillin, ceftriaxone, cefoperazone, erythromycin, and rifampicin. Having said that, rifampicin causes orange urine, right? But it can be given in the renal dysfunction. Okay. Next, antibiotics that do not need renal adjustment. Means you can give them and you don't need to do any adjustment for them. So neficillin, oxacillin, IOYA question. Right? Clindamycin and linezolid. And of course, doxycycline. Next, this is extra points. Drugs which are contraindicated in a liver disease. Drugs which you cannot give in cirrhosis or hepatic dysfunction. So what are the important ones I'm telling you, which you have to learn? Diclofenac. Okay, diclofenac, please remember, in liver failure, the safest NSAID is your paracetamol. Right? And amiodarone. This is what you have to remember. Methotrexate. Drugs which may require dose adjustment. This has come only once in your 10 years. So it is not that important. Fine. So renal पे question आया है, liver पे only once question आया है. I have given you a chart. When you find that question, you can learn it. Okay. Next, again, very important. Common nephrotoxic. medication. Always remember amphotericin B, aminoglycosides, lithium. They are very important. And one more, radio contrast. So, beta, this question came. A lady has diabetic nephropathy. Can you give her a contrast agent for the radiography? With caution. Contraindicated होता है, with caution you may give. अगर it is a big thing, then no. Very important, because it will further increase the nephrotoxic effect. Next, the drugs which cause liver damage. Right? Rifampicin. So see, rifampicin is such a troublesome drug. Erythromycin, valproate, isoniazid, and even the statins. As such, major drugs, they are metabolized in the liver only. So obviously, you have to be very, very cautious in liver failure. Next, benzodiazepines in patients with liver disease. Oxazepam, temazepam, lorazepam. Repeat question, this we can give. Next, drugs with high first pass metabolism. I've already given you a mnemonic, LPG. So like lignocaine, beta blockers, propranolol, and nitroglycerin, imipramine, morphine. Okay, these are the extra. Next, always a question comes upon ototoxic drugs. So ototoxic matlab, the ear is calm. Ear is not working. Ear is shant, calm ear. So very important again, aminoglycosides, cisplatin, loop diuretics, especially something which starts with E. That is for you to find out. That is your homework. Which loop diuretics which starts with E causes ototoxic effect. Even erythromycin, quinine, aspirin, and all those. But these three are very important. Okay? So very, very, very important. And this is the end of journal pharmacology PTR. The pharmacokinetics we had done earlier and pharmacodynamics we have done today. So after this PTR, journal pharmacology should be revised in max 15 minutes. Right? Oh, very good. You all are answering. Ethacrinic acid. Awesome. Awesome, my dear students. I'm really proud of you. Right? I cannot tell you how proud of you I am. And you all, really, just calm here. You all are now getting ototoxic for me. Calm. You are making me calm. Right? So why? Because I know that you all are working hard. And I know you all will make something good in your life. Right? So let us say again what we have to do. क्या करना है हमें? We have to work hard. We have to become the best. Option नहीं है बेटा. And we have to snatch our success. मेहनत करो, best बनो और छीन लो. Nobody is coming to give you the seat. And effortless is a myth. ठीक है? Bye.